Good morning, everyone, and welcome into JC Now. This morning we are talking about Victory Clinic in Junction City and location in Manhattan as well. We are joined by Dr. Kristie Clark from Victory Clinic. Her and her husband started the clinics. They've got clinics all over the state of Kansas. So much to get to, but first of all, good morning, Dr. Kristie Clark, and thanks for being here.
Good morning, Anthony. Thank you for having me.
Junction City, Manhattan, Dodge City, and then Lansing, Leavenworth. So you've got locations all across the state, but the location in Junction City is kind of the first original location, 2.5 years in. Just your thoughts on how things are going.
Things are going great in Junction City. We're busier than ever. Happy to be in Junction City because it really feels like there's a lot of people here that need services for treatment-resistant depression, and we're glad to serve the community.
Treatment-resistant depression is what you guys do. You just mentioned it. Maybe somebody is not really sure what you guys all offer. Can you talk about that?
Treatment-resistant depression is when medications fail to treat someone's depression. And people sometimes wonder, well, how many medicines do I need to fail in order to receive these treatments? And the answers for most insurances, someone only needs to fail 2 medications for depression from 2 different classes. And once someone isn't getting better on medications, usually medicines aren't going to work, and we want to look at other treatments for the resistant depression. The 2 main treatments out there that are safe, effective, and approved, we offer, and those are TMS, which is transcranial magnetic stimulation, and SPRAVATO, which is nasal esketamine. All our techs are TMS certified, and all our treatment sitters are SPRAVATO certified.
One of the things I think is cool about you guys is you and your husband are both doctors, and you're both at the clinic every day.
Yes, so we're both medical doctors. We both come out of a rural medicine background. We were practicing medicine in West Kansas for almost 15 years and doing everything, Anthony. ER, hospital, clinic, nursing home. He was the EMS director and coroner. I was the health officer. Yet, even though we had all those jobs, we realized that most patients were coming to us with mental health issues. About 25 or 30% of the patients that came to us had a mental health issues. And we realized that really the only tool we had was the oral medications for depression. We didn't have therapists in West Kansas, hardly, not many, not enough. And our patients many times weren't getting better. And we felt like the only thing we really had to offer them was listening. And that's why they kept coming to see us. And during the pandemic, mental health really got worse. The suicide rates actually went up. They were going up even before the pandemic. And we felt like what we were doing wasn't helping. So we actually considered during the pandemic, once we get through this, maybe not taking new patients with mental health issues. And we really had a change of heart. Once we learned that there were tools out there like TMS and SPRAVATO that could help people who medicines had failed, we decided to go back, redo our training. My husband went to Duke and did a visiting fellowship in TMS, and I did the work and the learning to learn how to start a SPRAVATO certified treatment center. And then we basically came back. We chose Junction because we felt like that was where we were supposed to start Victory Clinic. Both my husband and I are children of veterans. My dad's a disabled veteran. And we felt very strongly that Junction was where we were supposed to start with its proximity to Fort Riley, but also with the large veteran population here.
One of the things I think that's really cool about you guys is you guys don't just serve veterans, you serve all ages. Can you talk about how TMS and SPRAVATO, what kind of treatment they do and, kind of how you apply them?
Yes. So SPRAVATO is nasal esketamine. It's the nasal spray that's FDA approved for treatment-resistant depression. It's been approved since 2019, and it's approved for people age 18 and up. And TMS actually came out in 2008, which is really interesting because it's not in all the medical curriculums yet. Sometimes it can take 20 years for a new treatment to enter medical curriculums. So a lot of the work that we're doing is educating not just patients, but also healthcare providers about these treatments. So TMS was FDA approved back in 2008 for treatment-resistant depression. It's approved for age 15 and up. Now, a lot of times insurance and what they cover lags behind approvals. And so a lot of times insurance will only cover 18 and up. But really, we treat all ages of adults for treatment-resistant depression.
I want to get into this a little bit later too, but can you talk about some of the insurances you guys do accept?
Yes. So in our area here close to Fort Riley, one of the main insurances we see is TRICARE. Military spouses and their dependents do not need a referral to come see us. We're in network with TRICARE. Active duty members do need a referral to come and see us. Veterans, these services are also covered through the VA. Veterans also need a referral to come see us. Most commercial insurances will cover one or more of our services and do not require a referral.
And, we're talking about depression. How do you find the best meds, and can you treat depression without meds?
So certainly medications can be life-saving. And about half the time medications can be very effective for depression. For over 10 years now, we've been using the testing for genetic metabolism of medications, and we offer that testing at Victory Clinic, and that can help as a starting point to find the best medicine that might have the best chance of working for someone with the least amount of side effects. Now, the test isn't 100%, so sometimes we can try a medicine and it doesn't work, but we do have very good tools now where we can at least have a more informed decision about the medication that we choose for someone. And almost 100% of the time, people want this testing. Now, by the time a patient comes to see us at Victory Clinic, sometimes they filled not the 2 medicines they need to fill in order to qualify for the treatment. Sometimes they filled 7. We've seen as many as 30 meds. Usually with these folks, when we do the testing, we don't think we're going to find a medicine that magically is going to work that we haven't tried yet, but we are able to offer the patient information for why that med didn't work. And a lot of times that takes away the shame and the blame that they received over the medication not working, and they have a reason for why the medicine didn't work, which can be very helpful.
And the thing with medicine, too, is sometimes they're great, sometimes they're not so great. What are some of the side effects with depression medicine?
So even when medicines do work, unfortunately, they can have side effects. The main side effects we see with antidepressants are weight gain. And weight gain, of course, can lead to other health issues like metabolic syndrome, diabetes, heart disease, high cholesterol. And another frequent side effect is feeling numb and loss of libido. And people typically don't want loss of libido, but usually at the point, if you're having loss of libido, then you're really losing your desire to do lots of other fun activities in your life, like maybe eating or exercising or spending time with family or other social activities or playing games or spending time with your pets isn't as fun either.
So you talked about some of the insurances. For someone who is considering therapy but unsure where to start, again, mention what insurances cover these services you all offer, and how does someone find more about you?
Many insurances cover these services, and that includes TRICARE, VA, commercial insurances. Medicare will sometimes cover the SPRAVATO. Unfortunately, there are some insurances that don't cover these treatments, and that's always very unfortunate. And we do not have control over these insurance companies and whether or not they'll cover these services for you, but we do fight for our patients and we try our best to get approvals for these treatments when someone needs them. In the rare case that insurance doesn't cover, it's always possible to cash pay for these treatments, and we do have financing options. How somebody would find us, the very best way is visit our website, victoryclinics.com, and that's victoryclinics with an S.com. And there you can find not just our phone number, you're welcome to call us, but also we have messaging. And you can text us or message us directly through our website. That goes to a person. That goes straight to our intake nurse, Jessica, who will then reply back to you within a business day, get your intake done, look at your insurance, call them, see if you may qualify for your insurance to cover those services, and then get you an appointment in with one of our providers to do a medical consult, and then get you started with your treatments and on your healing journey.
One of the cool things you guys offer too in this is your accelerated TMS protocol. Can you tell me a little bit about this and also who this treatment might be ideal for?
Victory Clinic has the most advanced TMS systems in Kansas. We're the first in Kansas, the fourth in the U.S. to have the MagVenture neuronavigation system, which is like a mini MRI. These systems are also capable of very fast treatments. So whereas some clinics are still running half an hour to an hour protocols, our systems can run the same treatments in under 5 minutes. What that means is we can do accelerated protocols. That's sometimes referred to as the Stanford protocol or the S&T protocol. And that's when the ideal situation would be a busy professional, somebody like a doctor, nurse, lawyer, pilot, somebody that because of their profession, they really prefer not to take medicines and they prefer not to come in every day for 6 weeks, but instead may choose to take a whole week off work, come in, do 8 to 10 treatments a day with us for 5 days and go into remission and go back to work.
What are the hours of operation for Victory Clinics?
Most of our clinics most days are 9 to 5, but also at all our locations, we're working with extended hours so that we can help accommodate people who are going to school, working, parenting with later hours. So definitely contact the clinic that you want to see, reach out to our intake nurse and ask about that. Let us know what hours are best for you, and we'll try to do our best to accommodate that.
Another thing I want to mention, too, that you guys like to add is there's no wait list at Victory Clinic.
Correct. There's no wait list. So we understand that suicide's a top 10 cause of death. Suicide rates in this country are going up. In young people, age 10 to 34, suicide's actually a top 2 to 3 cause of death. And we realize that when someone's reaching out for help, they're ready to get help now. And so we do our best. We don't have a wait list. We try to get you in as fast as we can.
I want you to mention real quick your location in Junction City and also your location in Manhattan.
Our location in Junction City is on the west side at 715 Southwind near the intersection of Highway 77 and Ash. In Manhattan, we're also on the west side over on Venesta and Grand Mirror Plaza close to Old Chicago Pizza.
And you've mentioned that you guys have locations in Manhattan, Junction City, Dodge City, Lansing, and Leavenworth. So where can people go to find more information about you, and how can they directly get in touch with your office?
The best way to find us is to visit our website, victoryclinics.com, and you can receive information there for all our locations. All our phone numbers are there. But also you can find our direct messaging link where you can message us directly off our website or through that text number, and it goes straight to our intake nurse who will get back to you as soon as possible. Also on our website, there's a lot of information about TMS and SPRAVATO, and we have patient testimonies and just more in-depth information about these treatments if someone is curious and would like to learn more.
Well, congratulations on hitting 2.5 years in business here in Junction City and 1.5 years in Manhattan and Dodge City. Certainly appreciate all the work you guys do. And once again, thanks so much for coming